Hello, everybody. This is Michael from Blue Sky Bio. I'd like to welcome you to tonight's webinar presentation. Before we get to the presentation and the topic tonight, while everybody's joining and getting comfortable, I'd like to just talk for a minute about Blue Sky Bio's Pronto aligner system. We're going to be talking tonight about IPR and a proper and effective and safe way of handling those IPRs. If you are not yet ordering aligners from Pronto Aligners, I strongly recommend that you take a few minutes and check out prontoaligners.com/dentist. And what really makes the Pronto Aligner system a unique system is that it's based on the true and full anatomy of the teeth. Traditional aligner systems plan the digital tooth setup and the tooth movement based on the crown and just the crown, which traditionally, if you think about it, is actually planning your patient's case based on the fraction of the available information that we have today. Today, with modern technology, we have the ability to take into consideration the full anatomy of the teeth. The root-based aligner treatment has been proven to reduce mid-course refinement cases. So just take a few minutes, scroll through the website. You could see the benefits from true anatomical mechanical aligners. We have fantastic pricing, so you're actually getting premium aligners at value pricing. We have $4.99 for the smaller cases and $7.99 for the larger aligner cases. If you are interested in doing it yourself in-house, the full capabilities are built into the Blue Sky Plan software with completely automatic segmentation of the teeth, aligning the teeth to the crowns of the model scan, and planning the case based on that. We have additional advanced technology, including 3D virtual aligner simulation with the patient's actual face, remote monitoring solution for following up after the aligners are delivered, and we have a streamlined portal for delivering and tracking your case. When people use Pronto aligners, they're actually shocked about how much information is available when using the full true anatomy of the patient's teeth, both in terms of the digital tooth setup and how the teeth are moving during the treatment. If you're interested in communicating with us and getting more information, you can fill out the form on the bottom of the website. So again, that's prontoaligners.com/dentist. A few technical issues regarding the webinar presentation. We're going to be sending the CE credit for today's presentation via email, usually within around a week of the presentation. If you have any questions during the presentation, you could go ahead and enter them into the Q&A chat box, and they'll be addressed towards the end of the presentation. Today, we have the pleasure of hearing from Mr. Gory Cottinini on the topic of safe, accurate, predictable, comfortable IPR with DentaSonic. Gory, it's all yours.
Thank you, Michael. Allow me to share my screen. Okay, here we are.
Okay, great. I could see your screen.
Okay, so thank you, Michael, and thank you to Blue Sky Bio for having me, and thanks to all of you for connecting with us tonight. I would like to introduce myself briefly. I'm not a doctor. I have been in the dental industry for 12 years now and manage a distribution company in Europe and in North America. I'm originally Italian. I live in Milan, but I spend most of the time in airports, I have to be honest. So I travel a lot between Europe and North America, and I consult and develop several companies according to a specific reason of why I'm choosing these companies, and I'm going to go further in detail while I will introduce you one of these projects. And I'm really obsessed by education and training because I really want to understand and try to deliver skills and knowledge in order to address real patients' needs. So I have started in 2012 because I felt that there was something missing on the educational part inside the dental sector, because I started feeling the need of finding less invasive, extremely accurate, and safe procedures, because I am the father of a dysfunctional daughter, and I wanted to find everything possible on the market that could help my daughter to solve her problems. And I'm very happy that after 12 years, our company has been developing and delivering education and knowledge in over 28 countries, and we are distributing in several European and in the North American continent. But of course, let's go now into the specific of what we're going to discuss together tonight. I would like to share with you and understand the various methods to perform IPR. First of all, what is IPR and how can IPR become predictable and safe? How can IPR be not compromising for damaging the gingiva and avoiding over-reduction and discomfort for the patient? And I would like also to share some clinical and case results because we have been analyzing, and I personally have been analyzing this sector now for several years. So let's start from the basics. What is interproximal reduction? What is IPR? And the best way to understand what is IPR is to go and search for the definition that we can find in the Open Dentistry Journal since 2013. And you can read it here. It says that IPR is the reduction of mesiodistal dimension of a teeth, is a common practice in orthodontic treatment with fixed and clear plastic appliances. Regardless of the term used, such as interproximal enamel reduction or air rotor stripping or slenderizing or reproximation, it is the abrasion of interproximal enamel surfaces is intended to improve tooth alignment and long-term maintenance. Why do I want to share what is the definition of interproximal reduction? Because I have figured out that on the market, a lot of people, starting with patients and arriving to doctors, haven't really understood what is IPR and how it has to be performed. So in order to do this, it's always important to look how things have started. And so a small definition of what IPR is and a little bit of history of IPR. And also these informations, you can always see the source. So the first introduction of IPR dates back to 1944. Then in 1954, there is the Beck Stone Age Man's definition study, and these you find new informations of what is interproximal attrition and interproximal reduction. And in 1956, Hudson 4 introduced the first clinical sequence of IPR, employing medium and fine metallic strips for mesial distal reduction. This is the history, but from 1956 till today, a lot of things have happened inside the dental industry, and a lot of things have changed in regards to how IPR is processed and the reasons why IPR is processed on a patient. So we have to go back also to consider what are the benefits of IPR. And always, I source these on the internet, and you can find all of these information. So you can check the source at the bottom of the slide. IPR has been indicated in the following circumstances. So usually when you need provision of space for alignment, when extraction would result in excessive space and non-extraction treatment would result in undue arch expansion. Of course, tooth size discrepancies, when individual tooth size prevents class 1 molar and canine relationship from being established, to improve the shape or contact of areas of teeth, to reduce some slightly open gingival embrasures like black triangles, and to increase post-orthodontic alignment stability. In regards to this, one of the things that I found extremely interesting to discover was when you type in wrongdoings in IPR on the internet, and then you click on images and you go and see what is happening worldwide and what is happening here in North America. I'm speaking to you from Philadelphia right now, so I'm speaking especially to the North American doctors. What is important to understand is that there are severe consequences when you don't follow proper indications, when you don't have proper knowledge on how much enamel you can actually reduce, and when you use invasive supports to perform IPR. And There are health consequences for the patients, and there are law consequences for the doctors. So this is why I think it's very important for doctors to consider that there is actually a way to perform a safe and accurate interproximal reduction, because improper techniques could result in rough enamel surface, which could increase plaque accumulation and consequently lead to an increased risk of developing caries. But trust me, there are even more severe consequences. And if you go on the internet, like I have suggested to you, you will find that over-reduction can lead to dental hypersensitivity that for some people can become really extremely painful to have to live with that on a daily basis. It can lead to gum resorption, and in worst case scenarios, it can lead to root resorption. And these things are not only aesthetic problems, they can become really important health issues. So improper procedures are not even to take into consideration. And I have put only 2 or 3 images that you can find on the internet, but trust me, you can really find a huge amount of information. And I would like to point out that the patients that you see in these 4 images definitely did not sign up for having an end result as it appears in these pictures. These were patients that were just looking to have a nice smile, and maybe they were planning to have their teeth aligned, and they were not planning of needing composite rebuilds or veneers, or to find themselves facing severe consequences because somebody did not listen, did not train himself properly, and did not perform using a safe and accurate procedure. So this is why I really want to point out that it's very important for people listening to us tonight to understand that everything that you can find around the world is, of course, available, but not everything that is available is proper to be used. So we are going to start from a couple of useful informations, and you can always refer to the articles that I'm pointing out, because the first thing that we need to consider is how much enamel can maximally be reduced on a tooth. Because if we don't have this information, it's a very important starting point that we definitely should know. And the University of Heidelberg in Germany tells us that normally you can reduce maximally the half of the original enamel thickness. And typically, the average is not more than 0.3 millimeters of proximal enamel substance. This is a very important piece of information, because if we consider that on the market you find materials and supports such as strips, discs, or burrs that are even thicker than 0.6, 0.7, 0.8 millimeters, and you use them between teeth, you will understand immediately that the 0.3 millimeters will be definitely reduced more. So you will compromise the health of that tooth, and you will compromise the result of the procedure. Another important piece of information is that if we keep into consideration that 0.3 is the safety parameter in order to avoid over-reduction and to compromise the effectiveness of the treatment, and we consider that on the maxilla we have 11 contact points, and we multiply 11 by 0.3, it tells us that on the maxilla we are able to achieve up to 6.6 millimeters of space. And I have been told by several dentists, by several orthodontists, that 6.6 millimeters is a huge amount of space on an arch. So why do we need to over-reduce or to pull out healthy teeth when we can just follow the indication that science tells us to follow, that literature tells us to follow, stay inside safety parameters, not cause over-reduction to the patient, and achieve in obtaining the necessary space to move the teeth into desired positions? And we have exactly the same thing on the mandible, where we can achieve by multiplying 6.2, by multiplying the spaces and the 0.3 parameter, up to 6.2 millimeters. And also 6.2 is a pretty decent amount of space in order to achieve the movements that we want to obtain. So first of all, 0.3 is the safety parameter, tooth by tooth. Of course, it's the average. If you go and research for this scientific paper, you will have the exact amount divided by tooth, according if we're talking about molars, if we're talking about frontal teeth, if we're talking about canines, and you have the exact amount tooth by tooth. The average is 0.3 millimeters. Then after we have the parameters, we have to also understand what is the market offering to doctors in order to perform interproximal reduction. And you can perform in different ways. First of all, you can perform it manually, and then you can perform it mechanically. But there are different solutions to perform it manually, and there are different solutions to perform it mechanically. You can work with handheld or motor-driven abrasive strips. You can work with diamond-coated strips or discs. You can work with air rotor stripping, with tungsten carbide or diamond burrs. And all of these methods can be good or bad according to the protocol that you decide to follow, and according to the fact that the thickness and the abrasiveness of these solutions allow you to respect the safety parameters to protect the patient's enamel and to grant ethical and clinical solution towards the patient. So I wanted to find somebody that actually decided to create something that was safe, accurate, predictable, and comfortable. And so I have been finding and working now for 5 years with this Swiss company that decided to create a different scale of values. So they decided to start with patient's enamel safety. That is the main focus of the treatment. And how am I able to grant patients enamel safety? By delivering a precise and accurate treatment. And so as a company, they needed to find a way to create a system that allowed a precise and accurate treatment following the safety guidelines. And this, of course, leads to patient's comfort. And after that, the doctor has to be satisfied, and the doctor has to be able to perform it in a fair amount of time and in a safe way. So this is the way that they decided to operate, and now this system is used in over 55 countries around the world. You want to learn more about what difference can it make from the patient's point of view to receive a mechanical procedure or a manual procedure? I think that this research from the University of Darmstadt can really help us to understand. Because allow me to share this slide with you. And this is a very self-explanatory slide. On the horizontal bottom line, you find 9 different orthodontists. And these orthodontists are different in age, experience, body shape, and body weight. And on the vertical column on the left side of the screen, you will find the force measured in Newton force that is discharged on a patient during a manual IPR procedure or an automatic IPR procedure. The circles are manual strips, and the squares are automatic strips. What you can notice is that when the procedure is totally conducted by the doctor, the experience from the patient's point of view can be extremely different according to the experience of the doctor, the force that the doctor applies, the quality of the material he uses. So you can have, with the same strip, a high amount of force discharged on you or a low amount of force discharged on you, but definitely it's not comfortable from the patient point of view. When you take the doctor out of the picture, and it doesn't matter if the doctor is 2 meters high and 100 kilos, or if he's 1.50 m and weighs 50 kilos, it's not his contribution actively that compromises the procedure from the patient's point of view, because he just has to hold a handpiece that will perform the procedure without him having to influence the procedure in any way. And the squares are the strips, the automatic strips. So you see that the same orthodontist, when they are performing manually and when they are performing with an automatic system, they can change completely the perception of the patient if the procedure will be comfortable or if the procedure will be uncomfortable and unpleasant. I think this is a very self-explanatory slide, and it should help you understand that automatic IPR compared to manual IPR from a patient's point of view can be definitely something to take into consideration. Allow me also to tell you that you can find on PubMed different articles that will explain to you, not only from the patient's experience, but also from the clinician's experience, how you can perform a safe and accurate IPR procedure. And you can definitely find comparisons between the strips that you can find on the market, because, and we all know, we all live in the same world, there's always something cheaper on the market, but not every time everything is determined by price, and not every time everything can be determined by price if we are talking about health and we're talking about taking care of patients. So you can have some very extremely performing solutions that are also economically protective for your dental practice and for the patient's pocket. Or you can decide just to use the fastest solution without taking into consideration safety parameters, and maybe ending up with your cases being on the internet under the section of wrongdoings in IPR. I think that if you have a choice, being doctors, your choice has to always be the safety of the patient. And this is why I thank Blue Sky Bio for the opportunity of delivering this message towards you. Of course, I would like to have a lot more time to invest with you, because I could show you that there is a huge difference between treated and untreated surfaces, that there is a difference if you treat a surface with a 15 micron diamond coating, or if you treat a surface with 120 surface abrasivity diamond coating. There are huge differences in the amount of abrasiveness and the percentage of abrasiveness of the materials you use. And these things may lead to secondary consequences that are extremely severe for the patients. So the fact that we want to work with a system that will allow us to work in a safe and predictable way, but will also allow us to not create further damages, I think it's something that we really want to take into consideration. And that is why I invite you to research these articles when you have time to read them fully, but most importantly, understand that when you make a decision and you want to start performing IPR, if you are an orthodontist and you do it for class 2 restorations, you do it for interproximal reduction for aligners, you do it to gain space in traditional bracket system, or you decide that you want to use a burr, you want to use a disc, you want to use a metal strip, you want to use an aluminum oxide strip. There are differences and there are different consequences to using different kinds of systems. So what I strongly invite you to take into consideration is to find the solution that will allow you to perform in a safe way, that will force you to stay inside safety parameters, because it has been studied to allow you to work in specific coded systems, and that protects the patients before even considering anything else. So I think that the best way is to have a very simple protocol to perform IPR. We need to have something that will allow us to go quick and safe through the contact point. Usually it's a 0.1 strip. And you have a system on the market that will allow you not to break the contact point, because it's very important not to fracture the contact point and to respect the natural biology of the tooth, the natural biological shape of the tooth, but at the same time, to be able to control the procedure, because maybe you apply too much pressure and the strip will fall on the gingiva. And so if I have a solution on the market that does not allow me to cut the soft tissues, maybe I want to look in that direction. And then once I have opened the contact point, I maybe want to use something that doesn't have a saw anymore and that works only laterally, mesially, distally, and that allows me to enlarge that space, maybe working from 15 micron to 25 micron. So we always stay inside the safety parameters that we have established in the beginning. And then, according to the indications that we receive from the company, from our aligner provider, or according to our experience and learning curve, we will be able to understand if we need to work with the 0.3, with the 0.4, with the 0.5, always working with minimally abrasive strips, because they will allow us not to over-reduce the enamel of the patient and not to compromise the treatment. And then after we have achieved and obtaining the space that we need, definitely we want to polish that surface in order to avoid any kind of bacteria intrusion and to have a perfectly smooth feature. So we want to use maybe an extremely flexible strip that allows us to contour and polish, respecting always the natural biological shape of the tooth, and something that will allow us to create an extremely smooth surface. We have found this company, and I have been working, I told you, with this company since 5 years. And this company is called DentaSonic, and they have an extremely simple protocol. So we have the opening strip. It's the 0.1 strip. It's 0.1 millimeters of thickness and has an abrasiveness of 15 micron. So this will allow you to open the contact point. Its flexibility will allow you not to fracture it. And the points of the saw are specifically engineered not to cut soft tissues. So if in case the strip falls on the gingiva or you hit the lips or the tongue of the patient, you will not harm the patient in any way. After that, you can move to the 0.2 strip. It doesn't have a saw anymore, so it only works laterally, like I have told you. And we go from 15 to 25 micron, because that is exactly what you need to enlarge the operating space and to allow you to prepare what will be the active part of your IPR procedure. 0.3, 0.4, 0.5. It's according to the indications that you will receive in the aligner reapproximation tracker. I'm going to show you, excuse me, the one from Blue Sky Bio. And please consider that if you see that you have to reduce 0.3, you always have to start from 0.1 and allow you to reach 0.3. Because this, I know it may seem strange to hear, but this actually happens on a daily basis in a lot of dental practices, because doctors have never been trained properly in how to perform an IPR procedure. And so when they read 0.3, they just start with the 0.3. If they read 0.5, they start with the 0.5. And this is definitely something that needs not to be done. You have to always start from opening the contact point, respect the natural biological shape of the tooth, not over-reduce, and reach the point where you actively are indicated by the instructions. And in regards to DentaSonic, here you have only 40 and 60 micron. And you will never find a DentaSonic strip with an abrasiveness index above 60 micron. First of all, because it's totally unnecessary. And secondly, how you will be able to read in literature, everything that you find on the market with 90, 120, 150 micron completely destroys patient's enamel and may lead to extremely severe consequences. So this company has decided not to produce anything with a higher index of abrasiveness above 60 microns. And then you finish the procedure, you go back to 15 micron, and you work directly with an extremely flexible strip that will allow you to perfectly polish and contour what you have performed. This is the aligner IPR sheet from Blue Sky Bio, so it's the Blue Sky Plan Orthodontic Report, and as you can see, you will receive, according to the number of the tray, exactly how much you need to reduce, and all you have to do, you have seen that the strips are color-coded and that they have the indication of the thickness of the strip directly on the strip. So if you see 0.1, you will use the 0.1. If you see 0.3, you will start from the 0.1, and this will lead you to up to the 0.3, and you will stop at 0.3. In order to understand even better, I have prepared 10 seconds of videos with the full procedure from 0.1 to 0.5 and finishing and polishing. So I will show you exactly how it works, thanks to one of our KOLs, that is Dr. Al-Giriani. He's an orthodontist in Dubai. And this is how the DentaSonic procedure starts. First of all, you use the measuring gauge to verify this gauge has exactly the same thickness as the strips. This is the 0.1 strip. It's the strip that you will use to open the contact point. As you see, the doctor is not applying any kind of pressure, is only accompanying gently the handpiece, and the reciprocating movement of the handpiece, the back and forward movement, will do the procedure. As you see, there's no discomfort for the patient. There's no excessive pressure. Then after this, you will go to the 0.2. That, as I told you in the beginning, it allows you to enlarge a little bit the clinical area where you will need to perform the central part of the interproximal reduction procedure. We always suggest to use and accompany with water during this procedure. And this is the 0.2 strip. Once you have finished with the 0.2, if the indication tells you that you have to reduce up to 0.3, you take the 0.3 strip. As you see, it's always the micromotor that does the job. The doctor doesn't apply any kind of pressure, and you always can rotate up to 360 degrees the strip. It's extremely comfortable to work also on the posterior sectors. Then you go to the 0.3, from the 0.3 to the 0.4. You always want to double check what you have been doing. And so this is why it's important to always check after using the strip that you actually have reached the level of reduction that you want to achieve. And after, you see, in this case, the 0.4 gauge doesn't enter the space. And in those spaces, he needs to reach 0.4. So he will use the 0.4 strip to reach the desired space amount to be reached. This is the 0.4 strip. It's fast, predictable, and accurate, and absolutely safe for the patient. And after this, the 0.5 strip. This is the full protocol, starting from 0.1 with the opening of the contact point and working up to 0.5. And you have to trust me, there's absolutely no need to use anything that is more abrasive than 60 microns. You want to protect patient's enamel. You want to protect your job and the result of your job. And after this, you have the opportunity to work with Blue Sky Bio and with DentaSonic. You have the opportunity to have a specific aligner set on the upper right corner, where you have the full protocol from 0.1 to 0.5 with 3 finishing and polishing strips, and the handpiece with water, the measuring gauge, and the extraction tip. You have On the left side, the professional kit, if you are a dental practice that works also with class 2 restorations, that works also with composite buildups, that works also with veneers, and you also want to have the single side coated left or right strips, if you want to have different kinds of polishing strips, if you want to have a second head and a sterilization tray, if you want to have some extremely specific burrs to remove bracket glue or to contour the excessive composite, you have what is called a professional kit. If you want to work in a very precise way and you want to take your time and you want to work, especially working around veneers or working with very specific aligner cases, we also have a very delicate cordless unit. It's called IPR Evo. And this is cordless. It does not have water, so you will need to have water from your dental chair. And with the same handpiece, you will be able to perform the interproximal reduction procedure, the finishing and polishing procedure, and then with changing the head with the same handpiece, ordering the head, you will be able to perform also endodontics if you are a clinic that is a multidisciplinary clinic. Couple of informations before the final considerations of this brief moment together. Please always consider that it's important to read instructions. Not all systems work the same, so it's mandatory, and I really ask you to take this seriously into consideration. When you start working with a new system, you have to take your time to read instructions, to understand how to properly insert the strips, how to properly extract the strips. It's not something secondary to know. It's something important to take into consideration, because if we insert it wrong, the machine will not work properly. If we remove it in the wrong way, we maybe compromise the stem of the strip. And since these strips are sterilizable between 20 to 25 patients, according to how much you have used them, you don't want to compromise the opportunity of having the strip functioning 100%. Because if you bend the stem, it's extremely possible that the strip will start wiggling, and this will compromise the procedure, not only from your point of view, but also from the patient's experience. Another important way is how to set your micromotor properly. Not all dental chairs have the same micromotors, so it's very important to understand what is the correct handpiece ratio, what is the correct speed, and what is the correct torque. And once again, it's important to read instructions. It works with all air and electric micromotors. It's the EZO attachment, but according to your dental chair, the ratio may be different and the speed may be different. So once again, read instructions. Last but not least, maintenance is mandatory. Like everything we buy on the market, you have to take good care of what you use. And our handpieces request daily cleaning and daily lubrication, of course, if you have used them. So every time you use it, it has to be cleaned, it has to be sterilized, and it has to be lubricated. Also, because our systems have 1 or 2 year warranty according to the warranty that you choose, but the warranty does not apply if you don't perform daily cleaning and daily lubrication. So please follow instructions once again. Last, we talk about the assortment of the strips. You have all the strips that you need in 12-piece packages or in 5-piece packages. These are specific. They contain the full procedure from 0.1 to 0.5 with the finishing and polishing strips. They are specific. They are called diastrip and polystrip for aligners. So this is the aligner set. Then, of course, every strip that we have available has double side coated, single side coated left, single side coated right, from 0.1 to 0.5, finishing and polishing strips. You can have them also not assorted, but only 0.1, only 0.2, only 0.3, always in 12-piece or in 5-piece. I thank you once again for having had the patience to listen to a person that is not a doctor, but you have to trust me. I am really researching for everything I can find on the market that I would have wanted to find when my daughter was small and I needed to take her to the dentist. And it became something important for me. And I have been dedicating my time since the past 12 years in trying to share what I have learned as a father and what now is used by thousands of doctors around the world. So once again, thank you to Blue Sky Bio for having me. If you need to contact me, there is a QR code with my contact information. And I ask Michael if there are any questions, and thank you again.
Okay, so what we're going to do now is we're going to open up this session to questions. If you have questions regarding anything mentioned in the presentation or anything regarding the system, just click on the Q&A chat and you could go ahead and enter the questions into the chat there, or you can message me directly and I'll read the questions out. While we'll allow a few minutes for people to enter questions, I just want to follow up. We have a website, blueskybio.university. This webinar presentation, the recording of it is going to be available on the university website. Again, it's blueskybio.university. That website centralizes a tremendous amount of free educational information regarding a full range of our Blue Sky Bio products, both the implants, the surgical kits, everything connected to the implants and the surgical kits, and in addition, everything connected to our digital solutions, Blue Sky Plan, Lab Pronto, Blue Sky Monitoring, Bio Big Box, and everything else that we have there. We have a tremendous amount of free video content. We also have on-demand sessions where you could watch different recorded presentations. Those are paid presentations, but after you watch them and complete a short questionnaire, you're able to get CE credits for those presentations. So check out blueskybio.university. Again, there we centralize all of the educational content. In addition to this webinar presentation, the recording will be uploaded to the site in just a few days. And we also have information regarding upcoming webinar presentations where you could see that as well. Okay, so once again, we're starting to receive some questions. You can enter them into the Q&A chat box. I'll read out a few that have come in meanwhile. How much enamel can you reduce on a tooth and still be on the safe side?
Well, like we said in the opening, there is an indication by a university study that tells us that the average, like I said in my introduction, is 0.3 millimeters. Of course, this is the average that has been calculated. If you research the clinical paper, you will find the indications tooth by tooth, upper and lower arch.
Okay, how many patients can you perform with the same strip before substituting it for another strip?
Well, if we're talking about the IPR strips, so the ones from 0.1 to 0.5, the DentaSonic strips are sterilizable between 20 to 25 times. Of course, it depends on how they have been used and for how much time. They are granted between 20 to 25 procedures. If we're talking about the polishing strips, so the poly strips, they are guaranteed for 3 procedures from distal canine to distal canine, and then they are disposable.
Okay. What's the proper way of treating the handpiece in terms of proper functionality with the strips?
Well, as I said, it's important that, of course, the handpiece needs to be sterilized. The top part, of course, not the micromotor. The reciprocating head needs to be sterilized. And the important thing, since inside you have a really tiny micro mechanism, daily lubrication is important if you have used it. You can find these products directly on any company that sells dental products, especially the big players on the market. They have these specific oils for handpieces. They are universal. And inside the boxes, you will find the nozzle that is perfectly adaptable to the handpiece with the ESO attachment. And you will just attach this can to this nozzle to allow you the lubrication.
How does the system avoid any sort of damage to the gingiva or soft
Well,
tissue of the patient?
the 0.1 strip is the most important one under this aspect because, first of all, it's the only strip that has actually a saw in it. All the others work only medially and distally, so they only work on the lateral sides. And it has been designed specifically in order to avoid the cutting of soft tissues because it doesn't present acute angles, and it's more shaped like a wave. So I'm sorry I don't have a handpiece here with me because normally I show people and I put it directly on my tongue or on my lips, and it actually does not cut soft tissues. So I know that this is one of the biggest concerns for doctors when they are switching maybe from manual to automatic IPR. They are afraid that they may cause a damage to the soft tissues. But if you are talking specifically about DentaSonic, this does not happen.
Okay, where should dentists go to learn more, find out additional information? You said the QR code could be used to contact you, but
The
what
QR
would be the
code
next
also
step to learn
leads
more?
the QR code. Well, first of all, they can contact Blue Sky Bio because Blue Sky Bio is equipped and trained. They deliver these kind of training. Blue Sky Bio can put you in contact directly with me. And so you have the opportunity. If you request, you can also ask for an individual training. I can connect remotely with you, with your staff, and supply you additional information and supply you adjunctive training. On the QR code, if you scan it, you will find that there's the DentaSonic logo. If you click on it, you will find clinical cases, you will find instruction videos, you will find the brochures and the catalogs with all the products. So you have adjunctive information also following the QR code, but you can definitely go on the Blue Sky Bio website. There's a section where DentaSonic is present, and they also have all of these informations.
Okay, so just to reiterate a few points while we're wrapping up, again, the CE for the course will be sent via email, usually within around a week of time. This presentation recording will be available on the blueskybio.university website. In addition, there you have recordings from other past webinar presentations. You have information regarding future presentations, and you just have a tremendous amount of free educational content about Blue Sky Bio physical and digital products as well. If you have any additional questions or interest in reaching out to Gory, you could do that by contacting us at Blue Sky Bio or contacting Gory directly. And Gory, thank you so much for today's presentation. I think it was very informative and educational.
Thank
Thank
you
you for
for
your
having
time.
me.
Thank
And
you.
it's really important for me to find platforms like Blue Sky Bio that allow us to share, I think, useful information both for clinicians and for patients. So I'm truly grateful for the time that you have put available for me. So thank you again.
Okay, it's our pleasure. Thank you very much, everybody, for attending tonight's presentation, and we hope to see you at upcoming future presentations as well. Again, check out all the information at blueskybio.university. Thank you very much and enjoy the rest of your evening.
Good night.